Hello, this brief presentation is about the OBGYN Clerkship General Orientation. I want to welcome all of you to our OBGYN Core Clerkship, and I hope you'll enjoy it and learn as much as you can from this hands-on rotation. My name is Yahya Zaino, and I am an Associate Professor of OBGYN at SIU School of Medicine and your Clerkship Director. I work closely with Mrs. Cheryl Ashburn, who is the nurse educator. During your rotation, please direct any question that you may have to Cheryl or me, and we'll be more than happy to take care of it for you. The goal of this orientation is to give you a quick review and tips that might guide you and better prepare you before your arrival. This will allow us to save your time and focus on the hands-on orientation. It is very important to refer to the syllabus for the details of every clinical setting you will be participating in. For example, review the page of the labor and delivery in the syllabus before you do your L&D week. Do the same thing for prenatal store clinic, etc. Our curriculum at SIU is dependent on self-directed learning. We will do our best to keep you busy with clinical activities that will guide you in promoting your educational progress. Having said that, we are not following the traditional daily classroom lectures, but rather have you in the front line with patients and your team members. As you can see on the screen, these are the curriculum goals that we want to meet. They are the same goals for all clerkships, but there are some differences in the details and specifics. They include clinical immersion, coaching, direct observation, followed by targeted feedback and individualized professional development. During the rotation, while socializing with your peers, residents, and staff, please focus on your goals, as it is such a short period of time with us and there is a lot to learn and do. Let's start with the clinical immersion. As you are expected not only to develop excellent history taking and data gathering skills, but also to process the information and come up with appropriate list of differential diagnoses and management plan. So please incorporate your assessment and plan in your presentation. We would like you to be an efficient reporter of the cases you encounter, and also to interpret the data and process to ultimately become a manager. Documenting notes and improving your non-cognitive skills and communication with both patients and team members is also very important. The G's and B's statement is a unique thing we like to always include in our OBGYN notes and presentations. Knowing the obstetrical history will affect many things we do, and we like to make it clear and highlighted. We use the G as a total number of pregnancies, and P has the acronym of TPAL. T is term birth, preterm birth, abortion, living children. Term birth are deliveries that occur at 37 weeks and above, while preterm deliveries are those that occur at 20 weeks to 36 weeks and 6 days. Abortions include spontaneous abortion, elective abortions, and ectopic pregnancies. For example, if we have a 45-year-old G5P2123 patient, this means that the patient has been pregnant 5 times total and had 2 term births, 1 preterm, 2 abortions, and 3 living children. Oftentimes we use the shortcut by mentioning only the number of living children after the P, like saying this patient is a 45-year-old G5P3. But I like you to practice the detailed statement when presenting patients or writing notes. Writing an HMP in the OBGYN rotation When organizing, we start always from the chief complaint as usual. When organizing your HPI, you should start from the chief complaint as an opening statement, like in our example here. This is a 45-year-old derived of 5 para 2123 woman here for abnormal uterine bleeding. Then we discuss the details of the chief complaint. In our example, we would say the abnormal uterine bleeding started 3 months ago, for example. Her menses last 11 days and they are very heavy in the first 3 days, etc. Then we move to the third section, which is the information from the rest of her history that is relevant to the chief complaint. Like if this patient had a past medical history of DVT and is taking Coumadin now, or if this patient had a previous or past surgical history of endometrial ablation or myomectomy, those are important to mention in the HPI too. And finally, you will mention what the patient does not have, like she does not have pelvic pain or does not have vaginal discharge. Please keep relevant information to their designated section in the HPI. Do not start your opening sentence with something like, this is a 45-year-old G5P2123 woman with history of GERD, depression, and hypertension who is here for abnormal uterine bleeding, as these comorbidities belong to past medical history section and they are not intimately relevant to the chief complaint. As you see, writing the HMP for GYN patient is similar to any other specialty, but we give special attention to add separate section for OB and GYN history. For example, we like you to organize your OB history by listing each pregnancy, including the outcome, like vaginal delivery versus C-section or complications that happen in that pregnancy, like postpartum hemorrhage or preeclampsia, etc. So you may list them as first pregnancy, second pregnancy, third pregnancy, etc. For GYN history, use chronological order from menarche to menopause and include history of PAP testing, sexual transmitted diseases, contraception, hormonal treatment, and GYN surgeries. The rest is routine. The rest of the HMP. Pay attention to expand your differential diagnosis list starting from the most to the least common. Include the supporting fact that will work with or against each differential diagnosis. When presenting your patient, you will see patients in clinic and present them to the residents or the attending. Usually you present the prenatal patients following a problem-based form in your assessment and plan, while we present the full HMP for new GYN visits. For hospital inpatients, during the inpatients round, when it is time to discuss your patient, please feel free to step in and ask to present her. This is expected from you and our residents are used to it. Not presenting the patient might be interpreted as the student has not seen the patient. Notes review. You are going to review 3 progress notes with the chief resident and ask for written feedback. 1 postpartum note and 1 labor note with reviewed with the OB chief resident, and 1 post-op note with the GYN chief residents reviewed. We recommend you use system-based approach for your post-op note assessment and plan. The HMP is supposed to be a scheduled meeting with your preceptor to discuss your full HMP. And it has we recommend that it is thorough and complete. If you face a difficulty finding a mutual time with a busy chief resident. Then your backup person to discuss your note with would be the resident following the patient or your preceptor, the attending. Try to spare the interns as they are busy learning their own stuff, especially at the beginning of the year. I encourage you to refer to the syllabus for specifics of the notes. Coaching is an important element of this curriculum. You will be working with a preceptor. Mostly you're an attending, but also there will be also a good amount of time when you'll be working with a resident or resident team. A student will have 3 weeks with the same preceptor, as much as we can, but the 4th week will be on labor and delivery. During the labor and delivery week, we like to keep you on the floor, not with your preceptor. This will give you a better exposure to the whole picture as you will see patients in triage, which is our OB emergency department, and follow laboring patients, and also see them during their postpartum hospital stay. The feedback of this structure from previous students has been positive. This will allow us to expose you to the comprehensive care, as keeping you only with your preceptor, who won't be on the floor the whole week and might come from clinic to deliver one patient and then go back to clinic, won't give you exposure to the whole inpatient obstetrical care. So we will replace the continuity with the same preceptor during this week to the continuity with the same OB team that is mainly composed of residents and also of attendings who will do their 24-hour in-house shifts. Ideally, we like to keep you as much as we can and keep you continuity with the same preceptor for the whole rotation. However, we face some obstacles and difficulties that make this not easy to achieve. For example, if your preceptor has days off, or if the preceptor is not doing clinical work but academic or administrative work. So we have to use your time wisely and send you to other clinical activities. Also, some faculty members do more OB or more GYN, or their schedule for that month does not include many surgeries. Therefore, we try to give you some consideration to give you exposure to the common thing that you might be missing, hoping to make your rotation balance and your time with us is highly educational. So we give you a flavor of diversity on top of the continuity. The structure of our clerkship might be different from other clerkships. So you need to understand the dynamic of the OBGYN specialty. Please do not compare with other clerkships. Learn the new culture and adapt from day number 1. The specialty is a mix of clinic, labor and delivery, and surgeries. Sometimes the labor and delivery is very quiet and all of a sudden an emergency section happens. The most helpful thing is to try to mimic the pace of the team members, including residents and preceptors. The goal is not to give everyone the same experience or to cover all of the OBGYN field in 4 weeks. Please let's not waste time trying to compare. It's impossible to control how many hours each preceptor will work each week. As far as your workload is within the guidelines, then please, you are expected to do it. However, if there is something missing in your education due to scheduling or cancellation, for example, you're scheduled for a couple of surgeries and 2 or 3 of them are canceled, then please talk to us and we will work together to give you the best educational experience possible. Mid-clerkship meeting is supposed to address the progress, or you may contact us sooner if needed. The core clerkship is not the best time to customize your experience asking for only clinic or only surgery, but the PEP and the year 4 electives are the time to build up your own curriculum and customize it the way you like. When it comes to clinical emergence versus lecture, please remember the curriculum is not based on lectures. Friday sessions are mandatory and they are good time to gather with your friend and discuss your progress and how things are going and socialize together. However, these sessions are not lectures. Please refer to the syllabus for details and keep in mind the main purpose of this session is to encourage a free and informal discussion. Therefore, students' preparation and participation is expected. Targeted feedback is an essential pillar of the curriculum. Honestly, this is an area that we can do better as a clerkship. And I encourage all of you to actively seek feedback. The best time is on the spot right after or at the end of clinic or procedure, but that's not always possible. So follow up later with the attending or residents as they might need verbal or email reminder. If you feel there was some misperception or the feedback that is not fair, please talk to us. Keep in mind, not every feedback is a part of your summative evaluation, and we will filter them. The feedback is supposed to help you to improve. These are success keys during our rotation. Being proactive is very important. For example, if you are on labor and delivery and your peer student who attended two vaginal deliveries and you have attended none, but you have seen a C-section, then take action and discuss with the chief resident on day 2 or 3 of that labor and delivery week, and then the chief resident will assign you to follow a laboring patient who is likely to deliver vaginally during the shift you're working, and while your colleague will be doing triage or go to C-section, so you can see everything when you are working together. Be prepared, expand your knowledge, and communicate well with your preceptor, residents, and colleagues, as majority of problems, if any, are usually related to lack or due to miscommunication. Preparation, you are supposed to prepare for your surgeries you're assigned to, read beforehand, review pelvic anatomy video and other educational APGO videos, meet the patients before the surgery, meet your surgical team, introduce yourself when you walk to the OR. Even if you arrived late for whatever reason, make sure you communicate with your team members. In clinic, prepare and read the problem list of clinic patients that you are expected to see next day. Discuss with the preceptor which patient you need to review their chart the day before the clinic, as it's not a good use of your time to have to prepare 25 patients of next day clinic, but probably 5-6 patients that your preceptor will direct you to prepare and read about them might be helpful. Then you can efficiently see them and learn actively. Expand your medical knowledge early on during this clerkship will help guide you when you encounter your patients. When it comes to HMP, please know everything that you wrote in your HMP and search literature to support your clinical reasoning. We want to see your processing and plan, not a copy of the resident plan, for example. Vaginal delivery is a unique experience in medical school. It can be intimidating to an unprepared student, but we do want it to be one of your best experiences in your medical school, and it is usually for many students. At the same time, remember that it is a special time for the patient and family to have a baby, and you need to establish good relationship with your patients and during when you follow them during the labor process, and a good relationship with your team, including nurses, residents, and attending. And this will allow you to be more engaged. Preparation before you walk to a delivery room by reading and reviewing videos and discussing with residents and nurses is helpful. Simulation in the lounge about the delivery steps and review is good, and it's easier than doing it in front of the patient because that's not going to be very easy. And patient view you as part of their medical team. Acting confident and mature is expected. Performing a vaginal delivery is not guaranteed, but attending a vaginal delivery is required. If for whatever reason your week was extremely quiet and you could not see a vaginal delivery, which is extremely rare to happen, then we will find another time during the rest of your rotation when you can go and attend the vaginal delivery, or even if that will have us have you come on a Saturday or Sunday. Missing vaginal delivery for a laboring patient that you've been following for a few hours is not an uncommon thing. And it is not always the student's fault, but there are few things that can help you minimize the chance of missing a delivery, including working with fellow as students, watch for each other, stay close to the Model C, which is the delivery area or the rooms that are designed for deliveries, and also coordinate with your chief residents for patient assignment. And also before you leave the floor, you can for lunch, for example, you can discuss with your nurses and residents about the good time. Communicate, and be readily available. Leave your cell phone on the chart for the nurse to contact you. Practice fast gowning and gloving, as you don't have as much time before vaginal delivery as you do before surgeries. These are common subjects of reading for you that you must know when you attend our clerkship, and the sooner you know them, the better. For example, before you go to your labor and delivery week, please read about intra and postpartum care, review deliveries, vaginal deliveries and C-section, either videos or chapter. Read about routine prenatal care and the common problem that you will see in triage. Usually we see patients in triage after 20 weeks, so common second and third trimester complaint including vaginal deliveries, contractions, pelvic pain, not feeling baby's movement, high blood pressure, etc. In clinic, we see routine annual visit, so please make sure that you are up to date with each routine screening test recommendation, mammogram, pap test, colonoscopy, DEXA scan, etc. Abnormal uterine bleeding, pelvic pain, contraception, ovarian cyst. These are common topics and things that we encounter in the clinics. For the surgeries, please prepare before you go to your surgery. Understand the indication of the surgery, complications, and the anatomy, as well as pre and post-op care. Do not forget to review some educational video before these surgeries. When it comes to professionalism, we expect you to act as a team member and a physician with your colleagues, with the staff and the patients. None of the patients you will see during this rotation is a standardized patient. They are all real patient, and the expectation is that you follow good dress code, arrive on time, communicate well, expand your knowledge, be reliable, and avoid making up any missing information. Your preceptor might have specific expectation and style, so communicate with your preceptor and see what they like you to do. Also, please make sure that you complete your required task in a satisfactory way, in a timely manner. How do we evaluate you? We use on the fly in my progress for your evaluation, this written feedback. Some of it is used for your evaluation. Not everything in it is a summative evaluation, as there is good amount of feedback is just for your own improvement. Verbal feedback from whoever is working with you and faculty members. In our meeting, we discuss your progress and incorporate that in your evaluation, as well as our direct observation, and finally your completion of your task that you have to complete before you can pass this rotation. At the end, enjoy your rotation. Do your parts and do not worry about the rest. The expectations are not set low because we respect you and we do not underestimate your potential. I hope you have a 4 weeks fun educational journey. I will see you all soon for your hands-on orientation. And again, make sure that you are prepared and have fun. I hope that you'll enjoy it, and we will do our best. Be positive, and good luck. See you soon.